Have you ever felt your heart pounding in your chest for no reason, or a tight, squeezing pain that makes you stop in your tracks? These could be signs of high blood pressure, or hypertension, and angina. Millions of people around the world live with these conditions every day. It can feel scary and isolating, but you're not alone, and there's so much we can do to manage it. Today, we're going to dive deep into how we can effectively take control of hypertension and angina. This isn't just about popping a pill and hoping for the best. It's about understanding your body, making smart lifestyle choices, and working with your healthcare team to create a plan that's right for you. Think of it as building a shield to protect your heart. First, let's talk about hypertension, often called the silent killer because it usually has no symptoms until it causes serious health problems. Imagine your blood vessels as a network of highways. High blood pressure is like constant, heavy traffic, putting a strain on the roads and increasing the risk of accidents like heart attacks and strokes. The goal is to ease that traffic flow. Now, let's look at angina. Angina is chest pain that happens when your heart muscle doesn't get as much blood as it needs. This is usually because one or more of the heart's arteries is narrowed or blocked. It's not a heart attack itself, but it's a major warning sign. It's your heart sending an SOS signal saying, "Hey, I need more oxygen." So, what's the game plan? It's a two-pronged attack: lifestyle changes and, if needed, medication. These two work hand in hand. You can't just rely on one without the other for the best results. Let's start with the things you can control every single day. First up, your diet. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is a fantastic starting point. It's not about deprivation, it's about abundance. It emphasizes fruits, vegetables, whole grains, lean proteins like fish and chicken, and low-fat dairy. The key is to reduce your sodium intake. Too much salt makes your body hold on to water, which increases your blood volume and, you guessed it, your blood pressure. Start by reading food labels. You'll be shocked at how much sodium is hiding in processed foods, canned soups, and even bread. Try using herbs, spices, garlic, and citrus to flavor your food instead of reaching for the salt shaker. Next on the list is movement. Your heart is a muscle, and just like any other muscle, it gets stronger with exercise. You don't have to become a marathon runner overnight. Start small. Aim for about 30 minutes of moderate activity most days of the week. This could be a brisk walk, a bike ride, swimming, or even dancing in your living room. The key is consistency. Exercise helps lower your blood pressure, strengthens your heart, and can also help you manage your weight, which is another crucial factor. Speaking of weight, maintaining a healthy weight takes a huge load off your heart. Even losing a small amount of weight, just 5 to 10% of your body weight, can make a significant difference in your blood pressure and reduce your risk of other health problems. Another big one is stress. We all have it, but chronic stress can wreak havoc on your heart. When you're stressed, your body releases hormones like adrenaline and cortisol, which can temporarily spike your blood pressure. Finding healthy ways to manage stress is non-negotiable. This could be through meditation, deep breathing exercises, yoga, spending time in nature, or engaging in hobbies you love. It's about giving your mind and body a chance to relax and reset. And please, don't underestimate the power of a good night's sleep. Aim for 7 to 8 hours of quality sleep per night. It's when your body does most of its repair work. Now, let's touch on a couple of things to limit or avoid. Reducing alcohol consumption is important. While a little bit might be okay for some, heavy drinking can raise blood pressure significantly. And if you smoke, quitting is single-handedly the best thing you can do for your heart health, period. Smoking damages your blood vessels and hardens your arteries, making both hypertension and angina worse. There are many resources available to help you quit, and it's a journey worth taking. Sometimes, lifestyle changes alone aren't enough, and that's perfectly okay. This is where medication comes in as a powerful ally. There are many different types of medications for hypertension and angina, and your doctor will help find the right one or combination for you. For high blood pressure, you might hear about diuretics or water pills, which help your kidneys remove sodium and water from your body. Then there are ACE inhibitors and ARBs, which help relax your blood vessels. Beta blockers make your heart beat with less force, and calcium channel blockers relax the muscles of your blood vessels. It sounds complicated, but your doctor will explain why they are choosing a specific medication for you based on your health profile. For angina, some of these same medications are used. For example, beta blockers and calcium channel blockers can reduce how hard your heart works, decreasing its need for oxygen. Another common medication is nitroglycerin. This can be a small pill you put under your tongue, or a spray that provides quick relief from an angina attack by widening your arteries. Your doctor might also recommend a daily aspirin to help prevent blood clots. The most important thing with medication is to take it exactly as prescribed. Don't stop taking it just because you feel better. High blood pressure is a long-term condition that needs ongoing management. Think of your medication as your daily teammate in the fight for your heart's health. If you experience any side effects, talk to your doctor. Don't just stop the medication. They can often adjust the dose or switch you to a different type. Communication with your healthcare provider is key. Be an active participant in your care. Keep a log of your blood pressure readings at home. Write down any symptoms you experience, what you were doing when they happened, and what made them better or worse. This information is invaluable to your doctor in fine-tuning your treatment plan. Ask questions, understand your numbers. What's your blood pressure goal? What do your cholesterol levels mean? Knowledge is power. It's also essential to build a strong support system. Talk to your family and friends about what you're going through. Let them know how they can support you, whether it's by joining you for a walk or helping you cook healthier meals. Sometimes, just talking about your worries can make a world of difference. If you're feeling overwhelmed, anxious, or depressed, please reach out for help. Mental and emotional well-being are just as important as physical health. There are counselors, support groups, and hotlines available to help you navigate these feelings. Remember, taking care of your mental health is a sign of strength. Living with hypertension or angina doesn't have to mean living in fear. It means being proactive, informed, and committed to your health. By embracing these lifestyle changes and working closely with your medical team, you can effectively manage these conditions, reduce your risk of complications, and live a full, vibrant life. You have the power to protect your heart. Start today. One small change can be the first step on a journey to a healthier you. Thank you so much for watching. I hope this information was helpful and empowering. If you found value in this video, please give it a thumbs up and consider subscribing for more content on living a healthy and happy life. Take care of yourselves and each other.